For decades, doctors used to say the same thing. Keep your blood pressure under 140/90, no matter what. But in recent years, that advice has quietly changed. And if you're over 60, those changes could affect you directly. Today, we're going to break down what's actually going on with blood pressure guidelines, why they shifted, and what your doctor probably wishes they had more time to explain.
Blood pressure is simply the force of blood pushing against the walls of your arteries. The top number, systolic, measures that force when your heart beats. The bottom number, diastolic, measures it when your heart rests between beats. Think of it like water pressure in a garden hose. Too much pressure over time can damage the hose itself. In your body, that damage shows up as heart disease, stroke, and kidney problems. For years, the standard target was 140/90 for almost everyone. It was simple, easy to remember, and doctors applied it across the board. Then, in 2017, the American College of Cardiology lowered the threshold for high blood pressure to 130/80. Overnight, millions of Americans were reclassified as having hypertension. But here's the thing. For people over 60, the picture is more complicated than a single number. Many geriatric specialists and primary care doctors now argue that a one-size-fits-all target doesn't make sense for older adults. Your ideal blood pressure depends on your overall health, your medications, and how your body responds to treatment. It might seem logical that the lower your blood pressure, the better. But after 60, pushing numbers too low can actually cause serious problems. Overtreatment can lead to dizziness, fatigue, and dangerous falls, which are a leading cause of injury in older adults. It can also reduce blood flow to the kidneys, potentially causing long-term damage. Some studies have shown that older patients with moderately elevated blood pressure actually had better outcomes than those who were aggressively treated to very low targets. The body's needs change with age, and treatment should reflect that. So what do doctors actually recommend? For most healthy adults over 60, a systolic target between 130 and 150 is considered reasonable, depending on your individual risk factors. The key word here is personalized. Your doctor should be looking at the full picture: your heart health, kidney function, fall risk, and what medications you're already taking. A target that's right for your neighbor might not be right for you. Regardless of your target number, lifestyle plays a huge role. The DASH diet, rich in fruits, vegetables, whole grains, and lean protein, has been shown to lower blood pressure as effectively as some medications. Reducing sodium is also important. Most adults consume far more salt than they need. Aim for under 2,300 milligrams per day, and ideally closer to 1,500 if you already have high blood pressure. Regular exercise matters too. Even 30 minutes of brisk walking most days of the week can make a measurable difference. And don't underestimate stress management. Chronic stress keeps your blood pressure elevated in ways that medication alone can't fix. If you're on blood pressure medication, never stop or adjust it without talking to your doctor first. But do have that conversation. Ask whether your current target still makes sense for where you are right now. You should see a doctor promptly if your blood pressure consistently reads above 180/120. That's considered a hypertensive crisis. Also, watch for symptoms like sudden severe headaches, chest pain, vision changes, or difficulty breathing. Even without dramatic symptoms, if your readings are regularly outside your target range, it's worth a conversation with your doctor sooner rather than later. Here's the bottom line. Blood pressure management after 60 isn't about chasing a perfect number. It's about finding what works for your body, your lifestyle, and your goals. You have more control over your health than you might think. Small, consistent changes in how you eat, how you move, and how you manage stress add up over time.